Good Samaritan Hospital is located in the heart of downtown Los Angeles. The catheterization laboratory is a room purpose-built for cardiology that enables us to put tubes and lines and catheters into a patient for the purposes of making a diagnosis of heart disease and treating the patient with heart disease. But our room goes far beyond that. We are also able to provide surgical therapy in our new cardiac catheterization laboratory, hence the term hybrid room. What gives Good Samaritan's Heart and Vascular Center a competitive edge? This room, folks. It is only available at this hospital in downtown and metropolitan Los Angeles. Only one vendor makes a robotic arm, and we were lucky enough to acquire that technology. The advantage of our robotic arm technology is the following, is we are able to operate on any part of the body, from head to toe, in any surgical position, without the equipment being in our way. That has traditionally been the problem in old catheterization laboratories. When you walk into our new, in excess of 800 square foot hybrid room, you will notice a number of remarkable things. The highest quality equipment is on display with an 8 megapixel screen, literally 80 inches in size. The definition of our images allows us to see very clearly very subtle abnormalities in patients and in the procedure so as to make it safer and more efficient. The robotic arm allows us to operate on a patient in any particular location, moving anesthesiologists and surgeons around the room at lib, not compromising what we do to the patient. We are also able to do CT scanning on our table, where the robotic arm acts like a CT scan. We do not have to move the patient from our catheterization or hybrid room to a radiology suite in order to accomplish this task. What does the hybrid room give us that allows us the safer management of patients? Should there be a complication during a catheterization-based procedure, the patient can be immediately converted into an open heart operation with our cardiovascular surgeons performing surgery in an environment seamless, identical to their traditional operating suite. One of the new procedures that will be performed in our new hybrid room is called the transcutaneous aortic valve replacement. This little valve will be placed in the aortic position through a tiny little incision in the groin or through the chest without the need for open heart surgery. The patient will leave within 48 hours after heart valve replacement. A simple diagnostic catheterization may last 15 to 20 minutes. A very difficult critical limb ischemia patient at risk for amputation, necessitating opening of blocked arteries, may last 3 or 4 hours. The aim today is to get the patient home as expeditiously as possible, but not compromising safety. Many of our patients will leave the day of the procedure. The majority of our patients leave the following day. We have excellent solutions for pain management. Most of our patients are done under conscious sedation, meaning twilight sleep with local anesthesia. There is very little in the way of discomfort internally when we are operating on our patients. Any post-operative pain is handled with the appropriate oral or intravenous medications. Bloodless medicine is an emerging discipline and an expanding discipline in the United States, whether for personal preference or religious preference. A very robust program has been developed and supported at Good Samaritan Hospital for these needs. Our new laboratories will be ideal for the bloodless medicine program. Why do patients keep traveling miles to come back to Good Samaritan Hospital for heart care? It's the partnership of a wonderful team of nurses and technicians and forever grateful physicians. It's a warm, nurturing, and highly personal environment. A patient is not just a number. They are all treated with priority, kindness, humility, and dignity. Why am I practicing at Good Samaritan Hospital? That's a slam dunk answer. It's like coming home. You are welcomed every day, you are respected, you have the highest quality staff, the equipment is beyond superb. It's just a lovable, wonderful experience.